Hello, everyone. Thank you for joining and apologies for the technical challenges today. My name is Olivia Velez. I'm one of the co-chairs of the Global Digital Health Network and also a health informatics lead with ICF. And today we're going to be talking about digital inclusion. So improving health through digital transformation is one of the themes of this year's seminar, but we want to talk more about what does digital inclusion mean with digital transformation. So a focus on digital inclusion is to ensure that digital transformation efforts include vulnerable populations who are at risk, whether that's due to discrimination or geography or fragile state status or socioeconomic status. We want to make sure that everyone has access to the transformative benefits of digital technology, that they have access to the benefits of emerging technologies like AI and machine learning, but that also in this awareness that we are protecting people from cyber crimes and the spread of misinformation and the other downsides of technology. So with that, we have a really large panel today and a little short on time due to the late start. So let me introduce our panelists. So first is Alana Welch, and she is a digital strategy advisor with USAID, where she's helping to implement their global digital strategy. And she is the former director of the Principles for Digital Development. And she's going to give a high-level overview around the challenges of digital transformation from the USAID perspective. Our second panelist is Steve Wanye, who is the co-founder and CEO of Kenya's based Intellisoft Consulting, and he's going to speak about locally led digital transformation. Anna Ngururo is the Director of Technical Solutioning at ICF, where she leads work on PEPFAR's Data for Accountability, Transparency, and Improvement and Impact, which is the DATIM project. And she's going to speak about the role of cybersecurity in digital transformation and how to address privacy and security in low resource settings. Jenny Stockman is a senior manager at Macorize. Jenny has spent nearly a decade adopting innovative technologies to different political and social environments to ensure quality health services were efficient, effective, and accepted. And she will speak about emerging technologies in digital development and transformation. Tatiana Canzavelli is the CEO of the Open Health Network, a startup in big data, blockchain, and artificial intelligence in the healthcare space. She's a recognized thought leader and mentor for her ability to guide Fortune 500s and startup companies, and she will talk about digital transformation in healthcare and the private sector engagement. And finally, Kate Wilson is the CEO of the Digital Impact Alliance, known as DIAL, and she believes that digital technology products, new technology policies, and updated business model practices are required to make transformative change in the lives of the underserved and decrease the growing digital divide. And she will speak about effective strategies for overcoming challenges and accelerating digital transformations. So Alana, I will turn it over to you with your opening remarks.
Thank you, Olivia. Good morning, good afternoon, good evening, wherever you are in the world today. I'm delighted to be with you to discuss how we can support inclusive digital transformation with the communities where we work, particularly as it relates to the health sector. And it's imperative that we do so. Now, nearly 2 years into the COVID-19 pandemic, more than 4.7 million people worldwide have died, while 90% of countries are still experiencing disruptions in essential health services on a range of health issues, from infectious disease treatment to family planning and contraception to mental health care. Technology has an important role to play in responding to the pandemic. As has become so apparent this past year and a half, digital technology is transforming the ways in which we interact with businesses, governments, and each other. And as we've all experienced, the pandemic has accelerated digital transformation globally. USAID has long believed that digital technologies play a crucial role in achieving development goals. Yet the pandemic has also exposed the magnitude of existing digital divides between men and women, rural and urban communities, rich and poor, and young and old. Now there is a new urgency to not only digitize government and private sector services, such as healthcare, but also ensure that everyone, even the poorest and most marginalized, have access to and can benefit from the digital revolution. Unreliable, non-existent, or unaffordable internet connectivity, combined with a lack of digital literacy, are holding people back from accessing and maximizing increasingly digitized health services and accessing accurate and timely health information to meet their needs. Yet, as we promote greater investments in digital tools, we must also recognize that digital technology can present risks, such as increasing inequality, repression, and instability. Authoritarian regimes may seek to misuse health and genetic data, mis- and disinformation, particularly in the context of COVID-19, severely undermining public health efforts, or malign actors may use corrupt practices to secure contracts and purchasing digital technology. These risks remind us that our development and humanitarian assistance programs must use technology in a responsible and inclusive manner that respect the rights and privacy of individuals. To mitigate these risks in our programming, USAID launched the agency's first ever digital strategy in April 2020, a policy framework through which we are advancing open, secure, and inclusive digital ecosystems. Through the strategy, USAID staff throughout the world are working every day to ensure that digital technologies are used responsibly, to empower people, to bolster security, to improve health and well-being. We know that digital technologies that improve disease surveillance, extend and expand the delivery of care, and support remote health workers do not exist in a vacuum. They're embedded in and shaped by digital ecosystems, the enabling environment, stakeholders, and systems that make it possible for people and communities to use digital technologies to access services, interact with one another, or pursue economic opportunities. It is imperative that we work collaboratively to strengthen the entire digital ecosystem in our partner countries. For USAID, the digital ecosystem underpins all of our digital transformation work through the digital strategy. We believe that strengthening a digital ecosystem requires understanding and engagement across three pillars: digital infrastructure and adoption, which ensures that there is a secure and resilient digital infrastructure that is inclusive and accessible to all; digital society, rights, and governance, advancing robust internet governance and a strong policy commitment; and digital economy, promoting well-functioning digital service providers across institutions and building up a capable digital workforce. In addition to these three pillars, we found that it was necessary to also consider four cross-cutting topics when assessing a digital ecosystem: inclusion, cybersecurity, emerging technologies, and geopolitical positioning that impact every development sector. In support of the digital strategy, USAID's Global Health Bureau published their Digital Vision and Vision for Health System Strengthening 2030 this year. Both documents provide health-specific guidance for the strategic integration of digital infrastructure into our work. This guidance calls for USAID to support our partner countries' digital health capacity and infrastructure at the national level, moving away from siloed program-specific funding of information technology systems and toward co-investing in foundational, country-managed, and country-owned digital infrastructure that supports national health goals. The systems-based level approach includes USAID further investing in standards, open source software digital public goods, which are a key component of digital public infrastructure. We believe the strategic use of digital public goods can facilitate digital transformation and strengthen our partner countries' health systems while building resilience to global health shocks. But to fully realize this, we must work collaboratively. As a result of USAID's response to the Ebola outbreak in West Africa in 2014, for example, we saw the need for more coordinated investment in the creation and the deployment of digital public goods. In 2017, we helped create Digital Square, a unique mechanism designed to facilitate co-investment in smart and scalable health technology solutions. 5 years later, Digital Square has grown to encompass 18 investors, pooling funds to support 38 different digital public goods. These tools play a critical role in strengthening country health systems, facilitating better clinical and community delivery of health services, and responding to current disease outbreaks, including COVID-19. USAID announced earlier this year that we are renewing our commitment to developing, maintaining, and implementing digital public goods in the health sector by increasing the potential envelope for investment in Digital Square from an initial $50 million to $170 million, and extending this work by another 5 years. Of course, each country's ecosystem has unique dynamics and risks that warrant different engagement approaches to foster more growth, implement policies grounded in democratic values, close talent gaps, or extend digital opportunities. Through the digital strategy, the digital health vision, and investments like Digital Square, USAID reaffirms our commitment to leveraging digital public goods to meet global health goals and support inclusive digital transformations in our partner countries. Now is the moment for all of us to take a bigger step, one that ensures that digital is at the forefront of our health programming and activities, and that these efforts support inclusive and responsible digital transformations. We look forward to continued collaboration in this shared journey. Thank you again for inviting me to speak at this very important event. I look forward to hearing from my fellow panelists about their experiences with digital transformation.
Thank you so much, Alana. So for those of you watching online, if you want to put questions in the comments section, we'll try to get them over and catch them at the end of the plenary. So next, I'm going to move on to Steve. So Steve, one of the things that the USA Digital Strategy highlights is the need for local ownership and leadership. And you as a local business owner, can you talk about what you think the key elements are of locally owned and locally led digital transformation?
Thank you very much, Olivia, and thanks a lot for having me on the panel. It's a real pleasure to be here, serving the fellow panelists. I think for me, there are three key things, and I think Alana has actually touched on some of those. And for me, the first one is really just having a very robust, affordable, accessible, resilient, and reliable digital business infrastructure. I think first and foremost, if you're looking for local ownership, then that needs to be in place in a way that is actually affordable to local firms like mine, where we're actually able to compete at the same level, build world-class products and services, and be able to reach the market that we need to, that can actually serve people better. The case for digital health is already made, but I think the infrastructure, and that comes with what Alana mentioned in terms of the digital public goods, needs to be available and serve the local ecosystem, like where I serve. I think the second one is digital skills and values. And this really comes with having a digital skilled workforce. And this cuts across not just the hard skills of digital capability and competencies, but I think also the values that go with that. Today we're talking about digital inclusion, and that goes with a really high level of responsibility that we have, even locally, to ensure that the digital doesn't do any harm, that it's responsible, it's ethical. It's really based on the humaneness of what you're trying to solve. And in this case, really trying to improve the health and the well-being and the outcomes of the people we're serving. And for me, I think thirdly would be, just basically having the ecosystem that supports homegrown farms to generate world-class products and services. So basically having that sort of like innovation or innovation-driven enterprise, and that really comes from right from education at lower levels all the way into industry. And that if that is built around, it's built around digital transformation where local farms play or local enterprises and local entities play a leading role. Then it will definitely translate into that local ownership that we're talking about. And there are a couple of cross-cutting aspects as well, and I think Alana mentioned some of those. And for me, those are, first and foremost is legal and policy frameworks. And we're starting to see a lot of this emerging, just in terms of our governments stepping up and realizing the value of digital and data as well, and putting in place the right policies, the right legal frameworks that are enabling, especially for local entities such as mine. The other one, I think, is emerging tech. There's a lot of buzz and conversations around things like machine learning, artificial intelligence, algorithms, and all that kind of stuff. It's important for us to stay ahead and in tandem with the rest of the world. But at the same time, that means that that ecosystem for adoption of openness in terms of, especially in terms of content, and not just products like digital, global goods as traditionally were defined, but I think even more looking at content, especially and making that open to be able to drive those decisions on prediction, understanding what's coming our way, and being able to prepare for that and address that responsibly. And then I think thirdly is really just standards-based interoperability and data. Can't overemphasize that because without that, then the ecosystem doesn't really hold up. Yeah, so that's what I would say for now, Olivia.
Great, thank you so much, Steve. Okay, so we're going to move on to Anna next. So Anna, a secure digital ecosystem, as Lana has touched on, is really critical to our digital transformation efforts. And what critical steps do you think are needed to strengthen local capacity around cybersecurity, promote policy reform, and to protect the interests of consumers in relation to digital technologies?
Yeah, thank you very much, Olivia. Glad to be here, and very poignant opening remarks, Alana. You mentioned, and also Steve buttressed this, that cybersecurity is a cross-cutting issue here. Digital transformations by default bring change. Hence, they introduce digital threats and vulnerabilities when everything moves to the digital platforms. Digital transformation brings with them huge potential benefits, for inclusive and sustainable growth, allowing for us to increase the pace of meeting the sustainability development goals, like no poverty, zero hunger, good health and well-being, which are just basics, but also give an opportunity to citizens in low to middle income countries to not only survive, but also thrive. But this transformation definitely introducing vulnerabilities and threats. And if cybersecurity is left out, this means that this transformative digital technology becomes meaningless because people are unable to access or use it. For example, if you have denial of service attacks on e-government services that have become critical in low to middle income countries, or with innovations to improve access and delivery of health services that are subject to ransomware, or people being locked out of economic activity because they do not trust mobile banking technologies that have become central to people's lives. So the bottom line really is that digital transformation cannot be done without cybersecurity, and it is a key component. So some of the critical steps that we need to take to strengthen local capacity and promote policy reform, protect interests of consumers, begin with, first of all, recognizing that cybersecurity is everyone's responsibility. Despite this implied focus that cybersecurity is a technology issue only, it really is everyone's responsibility. However, in order to make that possible, people have to be able to be educated about the basics of personal data, what it is, what its value is, who owns it, why does it need to be protected, who owns that data, and why we should actually protect it and ways in which it can be misused. Citizens should be on the front line of this, and they need the knowledge and information. The second thing is that with cybersecurity, it's all about risk management. So appropriate risk management is necessary. Many people have the impression that once security has been implemented, everything is fine, that security is a one and done thing. However, security is about your present and ever-changing security posture. And this is measured via risk identification, prioritization based on risk and severity assessments, and appropriate risk management and mitigation strategies. Risk mitigation is not about eliminating risk, because this really is not possible, because every day sees a newer risk or vulnerability that has not yet been identified cropping up. So we have to be ready to meet those. The third point is that context matters. Cybersecurity, although critical, should be an enabler, not a blocker. so that when we are managing risks in the low to middle income context, that should be weighed. So we shouldn't go overboard with cybersecurity, making it so difficult for people to actually use technology so that they actually drop it. It should be an enabler. So for example, in 2019, ICF, under the Measure Evaluation Contract, conducted a security assessment of Uganda EMR, which included 6 clinics supported by USAID and CDC implementing partners. Uganda EMR is based on the OpenMRS software, and at each of these clinics, a slightly different version or customization was deployed. What was notable was that when performing the criticality and sensitivity assessment, which is usually based on 3 key areas, and these areas are data confidentiality, integrity, and system availability, Uganda EMR was assessed at a moderate to high confidentiality, while on integrity and availability, the assessment rated it as low. This is largely because the system collects, stores, transmits personal health information of individuals that, if compromised, could lead to individual stigmatization, loss of jobs, loss of reputation, and then also monetary penalties under Uganda Data Protection Act of 2019. However, because this system is used for retrospective data entry in Uganda, and not generally used for direct clinical decision making, that means that the risk here is assessed as low because inaccuracies in the records and availability or lack of access to the system does not directly affect service delivery or patient care. So in this case, the focus is to mitigate those risks that are to do with data confidentiality, as that has been identified as being moderate to high, and maybe less on availability and integrity, although these should be considered. Hence, many of the mitigation strategies should really focus on data confidentiality, like ways to reduce theft of clinics in the devices in clinics, to ensure access management using passwords into the devices, and then also locking the server rooms where these devices are stored, and making sure that not just anybody accesses these devices. This type of risk management really helps to focus on where the threats are coming from, and giving context, given the context that we are in, so that remediation of these and mitigation is focused on those. Remediation efforts are very costly. And so, by using these risk mitigation strategies and focusing on risk management, it helps to understand where, people should spend their money. Because again, cyber threats and vulnerabilities cannot be completely eliminated, but can certainly be minimized.
Thank you so much, Anna. That was excellent. Okay, Jenny, people are often skeptical of emerging technologies, but if we don't get everyone included in them, they're going to be left behind, and we're going to worsen the digital divide. So what resources are necessary for everyone to benefit from emerging technologies such as AI and machine learning, and how do we build trust with consumers?
Thanks, Olivia, and hi, everyone. So first, I want to say thank you for inviting me to join this panel. It really is a privilege to speak amongst this group of experts and to contribute to such an important topic. So first, and I think this is really important, I want to frame the context of AI and machine learning in global health. We often speak to AI and machine learning as new and emerging technologies, when in fact they've been around for many years. The newness comes from their application to solve some of the greatest challenges in global health. So for years, as we know, these technologies have been used in advertising, in finance, and many of us benefit multiple times a day from the power of AI and machine learning simply by using our phones and browsing the internet. People use it all the time, and our experience is that people are embracing it day to day. But in order to really build trust around AI and machine learning, it's important to understand what we mean by AI and machine learning. And in the context of global health, AI and machine learning facilitate a process of deep learning, which we apply to data scarce environments. And deep learning is inspired by how our own brains, neural networks, process information. That's to say, learning to focus on some details, but not on others. And in deep learning, computers look for patterns in data. And as they begin to see complex relationships, some connections in the network are strengthened, whilst others are weakened. So one of the things that makes deep learning so powerful is that it doesn't rely on any preconceived notions. It also can pick up on important features and patterns that humans can't possibly detect. And this uniquely positions machine learning to excel in resource scarce environments. And back to the question specifically and the idea of resource requirements, well, simply put, machine learning can be applied to the most challenging environments. I can use the example of Macrowise as deploying our technology in Sierra Leone, in Tanzania, India, DRC, Mozambique, Nigeria, and Ghana, among others. And in fact, some of the elements of our product were developed in the context of Sierra Leone and then later applied to the state of California, which is a great example of how minimal infrastructure can force us to think about resilience first, leading to a product which can be deployed at scale in any context. And we really do work daily in data scarce environments. And we've seen time and again that AI and machine learning can enable health systems to deliver more care with existing resources. Of course, and bringing it back to trust, this is easy for me to say and harder for program managers and governments to believe without tangible results. And without impact, skepticism will remain. And so it's on us as the global health community of scientists, strategists, and implementers to incorporate capacity building and transparency into any deployment of AI and machine learning. Success is going to be built on a collaborative way of working. That means networks of local academic institutions, local technical working groups, and local partners who ensure local ownership in the long term. Now, let me get specific and use an example of intelligent forecasting. The results of incorporating AI and machine learning into global health programs time and again show improved performance using the same data that is already available. And this is because most traditional forecasting models tend to use linear data history. However, in environments where change is constant, static forecasting simply is never enough. And conventional forecasting usually extends that historical data forward in a straight line based on the assumption that the future will be a near repeat of the past. Instead, precision machine-learned forecasting means less wastage, lower costs, and more lives saved with the same resources. The machine learns continuously from data, new and old, sensitive to changes in the country and in the market. And when you bring that together with supply and demand within health systems, you start to see that the predictability of demand with the optimization of supply really has a lot of potential. It becomes possible to equip countries to visualize whole health systems from their desks. And what is key here is that we use existing readily available data to generate repeatable predictions. This isn't about high-level analytics of understanding what the trends are going to look like in the long term. This is about giving healthcare workers, giving healthcare managers the tools that they need to understand what's going to happen day to day in real time, tools that they can use in their day-to-day work. Now, let's give an example. While we've seen an enormous focus on procurement, and never more so than during efforts to vaccinate populations against COVID-19, as was discussed earlier, governments around the world have struggled and continue to struggle to identify where to send supply. AI can provide the data-driven insights to address these barriers to equitable distribution of essential medicines using existing data in real time. You don't have to wait or rely on those historical trends. And the reason is that we can start to understand not only that supply, but also demand, adherence, or really any defined set of behavior or behaviors which are essential to that efficient and equitable health service delivery and access. You can't simply allocate those services based on a population. You need to know how many of those within that population are priority clients, which of those will show up for care, where additional resources may be required to support patients at high risk of adverse health outcomes. it becomes possible to use machine learning to predict that human behavior using, again, publicly available data alongside existing data sets within health systems. And we do that by deploying unsupervised machine learning to create the neural networks that I mentioned earlier. Now, of course, as we've already discussed, it's so important to address data security considerations because they are key to building trust. And data security simply is not optional. It's a central component of any deployment. Personal information, when available, is always de-identified, and data access and transfer sits within secure environments, adhering at all times to global data security standards. It doesn't limit what we can do by implementing data security standards. It actually improves what we are able to do because it builds that trust. And keeping this in mind and building on our multidimensional approach to learning, AI and machine learning can be deployed centrally or at site level. We don't have to take the data away from the country. We don't have to perform all of these fancy models outside the country. We've developed an approach to integration which can work both in the cloud or learn on device, meaning laptops, devices, and cell phones. So to summarize, AI and machine learning are not new, but their application to global health is. AI and machine learning use existing data, and data is protected at all times. And trust and collaborative working are essential to scalability and sustainability. Capacity at the local level to manage and own emerging technologies might not be available in all contexts. Therefore, establishing trust through working groups, local partners, and government engagement is going to be key. We recognize that local expertise is a gap transition in many countries, and we need to work together towards closing that gap. So thank you, and I'll hand back over to Olivia.
Thank you so much, Jenny. That was fascinating. So Tatiana, I'm going to move on to you. So increased adoption of global goods and use of interoperable systems have really allowed us greater access to shared data. And so what potential do you see for big data in transforming the healthcare system? And what role might private companies play in the development sector?
I'm honored to be on this panel. Thanks for inviting me. And there are a lot of good points have been raised and addressed so far in your fabulous opening remarks. As Jenny mentioned, AI, artificial intelligence, is not new, but it can help us to move healthcare to the future that is personalized, precise, predictive, and preventive. Everything that today's system is not. The technology has already changed how we treat cancer and many immune diseases, not to mention patient experiences. And it's going to play a much bigger role over the next 5 years and beyond, leading to a future where we take a much more holistic view on what comprises health. The concept of AI is pretty straightforward. It uses kind of computing power available to us today to analyze large, complex, and diverse collections of data in a wide range of forms and formats, identifying trends and correlations that could be impossible or very difficult to do for humans. These insights can be used to support human-directed decisions or to allow, that's in the future, computing systems to make decisions independently. In practice, AI is challenging to implement. It requires the use of complex models that need significant expertise to create. And we talk about data science and also subject matter knowledge. It also requires the development of complex algorithms for analysis and learning. Done correctly, an AI system is able to build upon prior decisions and analysis to order to continuously improve results. The more you use it, the more it knows and better it gets. I have the whole presentations on how we develop and deploy AI models from natural language processing to deep learning and everything else for disease progression, prediction of outcomes, and integrating behavioral into healthcare, which is an important aspect. And I'm super excited about us working on creation of digital twin, where we use data from environment, from devices, from clinical grade in consumer devices all the way to claims data, HR data, and everything in between, to create a digital twin and use that to prototype progression and build predictive models that can be deployed globally, and we're changing it all in healthcare. Public-private interactions have become pretty common in health sector. Governments, multilateral institutions, and industries are applying these arrangements to address diverse health-related issues. Goal 17 of the United Nations Sustainable Development Goals for 2030 actively advocates for countries to encourage and promote effective private-public, and civil society partnerships. Immense threats to health cannot be tackled by governments alone. Healthcare is a constantly changing environment, from shifting demographics to rapidly evolving therapeutics, treatments, and technologies, to emerging diseases, conditions, and service. So private-public partnership design is evolving to address these changing needs. By leveraging private sector expertise, financing capacity, systems, and management discipline, public health systems have been able to take advantage of new technologies and clinical support practices for their populations. We at Open Health Network are honored to be a part of public-private partnership for many years and help with pressing issues impacting healthcare today. Thank you again.
Thank you so much, Tatiana. That was enlightening. So finally, we're going to turn to Kate. Kate Dial has played a critical role in the digital development space, including hosting the Principles for Digital Development. What are some effective strategies to overcoming barriers to digital transformation, and what are the key components to achieving sustainable success?
Thanks, Olivia, and thanks to my fellow panelists. And I really hope everybody takes the opportunity to actually put in some questions, because I'd love to have us all sort of engage in debate. I think this is a really exciting group. As I was listening to everybody, I was sort of thinking maybe we can take a step back and kind of reorient back to where you started, I think, Olivia, as well as Alana, in terms of what does it mean to do digital transformation? And how is that different in the health sector versus how might it work for a national digital transformation? So DIAL, the Digital Impact Alliance, is a think, do, replicate tank. And our emphasis is cross-sectoral work. So we do not focus solely on health, but we look at how cross-cutting digital practices could take place. And increasingly, as Tatiana was just talking about, like in order for goal 17 to be achieved, but really all of the digital goals, we believe that it is essential that everyone have the components that Alana talked about. You need access to connectivity. You need to actually be able to access the internet. You need to be able to afford it. You need to have the right content. You need to be able to use it. All of the things that people have talked about here today. And then we need to have optimized applications and services that then sit on top of that. And those can be optimized by AI, machine learning. And then there's definitely, kind of balancing the cybersecurity risks, threats, and opportunities that come about with this. And so how the data is actually used. I'm going to take a step back and sort of talk about, like, what does it mean for national digital transformation? So there's 194 countries in the world who are on some journey towards national digital transformation. Every single one of those is grappling with exactly the same problems. And I think that we need to be really clear, like, nobody has figured this out. There's no like perfect best example of what it means to do a great national digital transformation. We have many examples: Rwanda, Estonia, India, Singapore, but we don't really have sort of a universal idea of what it means to do a national digital transformation. And then we really haven't gotten to the hard work of understanding what it takes to connect together the health sector, and machine learning and AI is applicable in the health sector, as Jenny talked about. It's also really applicable in terms of its usage, and societies need to use them to apply to education questions and agricultural questions. So really looking at, like, how do you actually knit those challenges together across sectors and put in place both national digital public infrastructure, identity systems, payment systems, data systems, et cetera, bounded together by interoperability, but then really unleash new creativity that can stand on top of them that then can feed individual services. And so I just want to talk a little bit about sort of a framework that we find relatively useful when you think about like what it takes for a national digital transformation to take place. And we kind of call it the 5 Ps, simply because I think that mnemonics are really helpful to make people kind of remember them. So, first and foremost, and one that we sort of added in the last year, is actually the political will to do it. So it's interesting because Alana was actually demonstrating that in terms of, you've seen both the US government, but also most donor governments, as well as, key regional entities such as the African Union, the EU, also begin to take a really strong view. So there's high political will that is beginning to take place around national digital transformation. And that really drives the rest of the system. So the second part then that they need are like, what are the appropriate products that actually are required? So we dove deep into like some of the products that can potentially be used, but there's millions of open source technologies, some which we're supporting, 38, I think Alana had mentioned for Digital Square, they're being supported, but there's also digital public goods that are supported that are in other sectors that also could be re-leveraged. So I think when you think about the products, it's both determining, trying to find what already exists, it's consistent with the digital principles. So Alana will appreciate this, reuse and reuse what already exists, and then design with the user in mind. So making sure that you can, find the products that are already designed with the user in mind, make sure that then that they can be deployable and interoperable, often as Stephen was sort of suggesting. The second piece then, also which Stephen was really talking about, is kind of the people that are involved. And we often talk about that as being, people who are end users of technology. It's also the people choosing and using the technology. Sometimes that exists within donor governments, sometimes that exists within like a country government itself, as they're starting to look at what technology are they going to deploy, and is there something already deployed in the country that actually could be reused, or something that they can make sure that they can maintain over time. Because we have to talk about, the hard part of this, which is it's not really just putting the system in place the first time, it's making sure that it gets sustained and institutionalized across government use over time. The third place is really, and the tied to that is really the pricing and procurement of those services. Like, we tend not to talk about the business model, but we've, as Jenny said, a lot of this technology has been out there, but how easily procured it is, how priced it is for the local market, and how you can actually, again, bring that in is a huge part of this. The last area that I really want to talk about is sort of then the policies that are along the lines of this, and making sure that policies are actually fit for purpose. So Anna talked about that when she was talking about cybersecurity risks and issues, but we also look at it in terms of, do you have sufficient data privacy regulations? Do you actually have kind of a whole of society trust-based approach for inclusive national digital transformation, which actually has consent? And to what level is that appropriate? Right now, we have multiple models of this. We have sort of, kind of the company-led model, which is often predominant in the US. We have the European model, which is kind of predominant via GDPR. They have sort of an authoritarian regime model of sort of data privacy, but really for most countries, they're trying to thread the needle between that and figure out what is most appropriate for them, and how can they, to Anna's point, really deploy things in a way that it protects everyone, but also really takes into account the fact that, we're at very nascent stages and we need to not put up so many barriers. So those are some of the 5 things, I guess, that we think about that sort of are key to national digital transformations. And I guess the main message I would implore to this audience is, while you focus, as you should, razor focus on the health sector and health information systems that you are putting in place, please make sure that you are also looking at what's already being deployed at the national digital level, because the sustainability of the systems that you are putting in place is really going to be tied to whether or not that digital infrastructure comes in and can work with what is already emerging in most countries that we're working with. So thanks so much again for the opportunity, and looking forward to the questions.
Thank you, everyone. We are a little bit over time, but I think the platform is still down, so we can keep going as long as you're able to stay. I know some of you might have to drop off. But this has been really fascinating and really an engaging talk. And thank you all so much for participating today. So we've talked about like so many different things, and it's really exciting. So one of the things that I'm interested in that I think came across all of your kind of talks is that, there's like this education component to, what do people know so they have the trust in the system, they have the capability to use these tools, and they're able to be successful. So what do you think? Actually, I saw a talk this morning where they're like, none of the nurses over 40 wanted to use this digital health tool. So I know this is a big challenge for us. So what do you think are the required kind of skills and knowledge that we need to get out there so that people can adopt these technologies? And anybody could take the question. Go ahead, Tatiana.
I think this is like a great point. I can give you my recent example. So I was on a flight, and that airline switched to contactless payment, right? And there is an older lady next to me, and she just wanted to get a glass of wine. Well, she didn't have an app on her phone. She didn't know what she needed to set up in that app. So basically, simple thing of getting wine, wasn't built, in solution has not been built in an inclusive way, right? So I think, we need to design and deploy solutions that build in an inclusive manner. There are people with disabilities, different level of experience, and it's our responsibility to look at every participant in healthcare ecosystem, from physicians to nurses, caregivers, patients, to design all inclusive solutions. And secondly, of course, as you rightly mentioned, we do need to come up with educational materials to bring people up to speed, but we shouldn't be expecting people to adapt to what we build. We need to build adaptive solutions so they can use it.
Great. Kate and Jenny, I know you need to drop off. So if you have one last word, say it now. Other than that, thank you.
I actually want to chime in quickly on what Tatiana said, and make one point that we often talk about digitizing societies and national digitization as this idea that everything is going to go digital. And that's actually not always the case. And speaking a little bit to what Kate was saying and integrating with existing platforms and solutions, it's important to recognize not just the decision makers who buy into these technologies, but the end users, like the old lady on the plane who wants to buy a glass of wine but doesn't have an app on her phone. And we can still embrace digital technologies. We can still embrace like AI and machine learning and every other tool and product that's out there, whilst keeping in mind that the delivery mechanism at the end of that implementation won't always be a fancy dashboard. It won't always be an app. It might still be a piece of paper. It might still be something that is printed and is tangible, but what drives what's on that piece of paper can be driven by the most advanced technologies available to us. And so we shouldn't shy away from it just because we deem the end user to not quite be at the level that we think they need to be at to be included in digital transformation, because it should be inclusive across all levels of society. And yeah, I do have to drop, so thanks everyone for your time.
And I'll just echo what Jenny said, because I think it was perfectly said, is that it doesn't have to be an either or, right? It's not national digital transformation or meeting the user where they are. It's actually bringing the two together. And I think that the more that we as a community kind of humbly go into that and say, there are people who are going to embrace this and people who are going to be afraid of it. But we can actually together work towards, a new kind of social compact, where basically we are combining it and that we're using the best of what this technology can offer to actually do more precision-based healthcare, education service delivery, citizen services. Then you're actually going to see, a world which is inclusive, not a world in which it's just digitally inclusive, because it's about the inclusion, not about the digital solely. Thank you. And I also have another panel. So thank you all so much. I wish we could have had more time.
Sorry, I was on mute. So thank you, everyone. And that was a great closing. So if anyone else has a key takeaway, please say it now. Other than that, we can wrap this up. And to those of you who are online watching, please follow up in the chat. Oh, Steve, go ahead. give you your closing thoughts.
Oh, sorry, Olivia. I was going to try and answer your question and say that I think with regards to education, as you asked, I think the sort of very structured and programmatic digital literacy, I think it's pretty clear what needs to be done. Designing good systems and all that. But I think one thing that keeps getting forgotten a lot is, I think the value for the digital product of the system to the user. I keep getting awed every time I look at the probably way too often quoted M-Pesa, and I see a lot of especially traders, informal traders who are completely illiterate in terms of just the academic education and all that, but using it really efficiently to transact business and all that. And that one keeps reminding me that there's a very strong component about value and motivation. And then I think secondly is also our definition of education and literacy. I think also needs to a very strong aspect incorporate indigenous education. I think there's a lot of that is left behind or ignored that is very critical in terms of usability of these solutions. Thank you very much.
Thank you so much, Steve. Okay, now we really got to wrap up. As the co-chair, I do have to keep things on time. All right, so thank you so much again to those watching. Please go on the platform. You can find all our speakers. You can send them a message if you have follow-up questions. And I hope you all continue this conversation and really make digital transformation inclusive for everyone. Take care, all.